Hello and welcome everyone to our very first Q&A session dealing with MSK ultrasound. And I'm extremely excited because this is also a new area that we're embarking on as 123 Sonography. And we're very, very happy to have Marc Schmitz with us from SonoSkills, and he'll tell us a little bit more about what SonoSkills actually is. So can I hand it over to you, Marc?
Hi, Tommy. Hi. Thanks for having me here. So, hi everybody. Greetings from the Netherlands. My name is Marc, and SonoSkills is my company, which I founded in 2010. And since then, we have been busy a lot, doing a lot of courses worldwide. At the moment, we are teaching in about 25 countries, and we are teaching primary care professionals such as physiotherapists, podiatrists, hand therapists, but also secondary care professionals like radiologists, orthopedic surgeons, rheumatologists, sports medicines, family doctors as well. So this we do with many trainers. We have a trainer team of 25 people, and these trainers have also a various background, not only in culture. I think they speak in total like 12 languages, but they are also from various backgrounds, also like rheumatology, radiology. So actually they reflect the professionals we teach. So that's a little bit in a nutshell about SonoSkills, and it's good being here to talk about MSK ultrasound, because it's such an amazing development in MSK ultrasound in the last years. So so happy also with this collaboration with 123 Sonography.
Yeah, it's really, really great to work with you guys. It's really been a very amazing journey, and to be honest, me coming from cardiology, I haven't really realized the importance of the topic of MSK until I met Marc. And of course, now listening around and seeing what is happening on our platform, we see more and more people engaging in learning MSK ultrasound. And maybe at some point in time, I'll try to use the transducer on other parts of the body, such as maybe, I don't know, the joints as well. So I'm here also to learn, and I'm also here to listen to the community. So what you obviously have is you have the ability to ask questions. That's what it's all about. You have this little chat box, so you can place your question there and you can send it to us, and we'll answer these questions as we go along. Of course, we also got many, many questions up front. So we are prepared for these questions. Marc did a great job in, of course, illustrating these questions. But please don't be shy. If you have a question, even if it is a very simple one, send it to me and we'll be happy to answer it. So basically that's what the format is. And I think I'll just jump right into the topic. And the first question we got was from let me go to the slide, from Roberto, and he wanted to know which anatomical tissue can be assessed with MSK ultrasound. What is your take here?
Yeah, so if you go to the next slide, Tommy, then you'll see this grayscale going from black to white. And this is important to understand, that these colors, they reflect the tissues. And maybe it's better to say they reflect the how hard a certain tissue is. For example, on the left side, you see the very dark colors, and these dark colors, if it's really pitch black, it's called anechoic. And anechoic reflects actually very, very soft tissue, actually fluids. So if you think about synovial fluids, if you think about bursal fluids, those would really resemble like pitch black. The more you go to the right side of the screen, the lighter the color actually gets, but also the harder the tissue will get. So, for example, the opposite of dark is, of course, white, which is on the other side of the spectrum, and that is the very hard structures, like, for example, bone, but also like metals, prosthetic prosthesis. In between, you can see this grayscale going from muscle to tendon, and then between tendon and bone, you have ligaments and calcifications. So these are, let's say, the colors you can see. And Tommy, if you go to the next slide, then it's what we see in this diagram is actually this flow chart. Is that MSK ultrasound is a very good tool to assess the extra articular tissues. So think about bursa, tendon, muscle, arteries, veins, nerves, sometimes also cartilage, like fiber cartilage, hyaline cartilage, everything soft and superficial. This ultrasound can actually assess. Ultrasound is not so much designated for intra-articular structures, or if it comes to really to the bone, we can see bone, only the superficial layer, but underneath bone we cannot see. So best is actually extra-articular soft tissue. So let me show you some examples. So the next example is actually, this is a transverse scan, so a cross-section of a quadriceps muscle. So what you can see in the top of the screen is a thin white line. This is the skin. Then underneath the skin, we see a dark zone. This is the fat tissue, subcutaneous fat tissue. And then we can see 4 muscle bellies of the quadriceps wrapped around the femur bone, which is located in the middle of the lower image. That's the femur, yes. So these 4 muscles, the vastus lateralis, the intermedius, the rectus femoris, and the vastus medialis, those muscles can be seen as dark gray structures. With surrounding, you can see the epimysium layers, the white hyperechoic layers wrapping around the muscles. So this is actually mostly a muscular example. So let me show you the next example. And the next example is the infrapatellar knee. So what do we see? We see the patella bone on the left side of the screen. It's higher in the screen. And yeah, that's one with a shade underneath. And that's because the beam of the ultrasound hits the bone and is being reflected back. So the bone cannot absorb actually the beam, the ultrasound beam. So this is also the reason why we cannot really assess the bones, at least not the deeper parts. On the other side of the screen, we can see the tibia, and this bone is, as you can see, quite large. And if you look closely between the tibia and between the patella bone on the left, we can see in the top horizontal fibers, and this is the patellar ligament. So the 3 white triangular markers, they indicate actually the patellar tendon. So this is a tendon, and you can already see the difference between the muscles and the tendon. The tendon is a little bit harder from structure and therefore also a little bit more wide. And underneath the patellar tendon, we can see the Haffa's fat pad, which is a fat tissue. And then really in the depth, we can see a little bit of a crescent-shaped hypoanechoic zone. And this is the hyaline cartilage of the knee. So we can see bone, we can see fat, we can see the hyaline cartilage, and we can also see the patellar tendon. And the next slide, I can also show you the nerve. And this is a carpal tunnel, so with the flexor tendons and also with the median nerve. And the median nerve is located somewhat in the middle of the screen. It's a oval shape, oval shape hyperechoic structure, and that's the median nerve indeed. And now we're looking at static images, but what I think is really amazing in ultrasound, and that's the advantage, I guess, is that you can look at it real time. For example, if this nerve, if you want to see the neurodynamics in suspicion, for example, with a carpal tunnel syndrome, you can move your fingers, or the patient can move the fingers, and then you can see the nerve actually moving and going from medial to lateral and showing the neurodynamics. So yeah, you can see that we can see in detail soft tissues, and I've learned ultrasound in roughly 2003. If I think about the systems then and now, that's a huge difference, because nowadays the technology has so advanced that, and it is getting, every year it's getting better, that the anatomy, nowadays we can observe it really beautifully. Last thing I want to show is actually this slide, and this slide shows you actually that although we cannot see really well the bone, we can see the superficial layer, and this marker, this where the laser pointer is pointing now, you can see a little step of deformity, and this is indicating a fracture. So although ultrasound is not good at assessing bone, you can screen for fractures. And you don't know which type of fracture it is, and you definitely should send in the patient to hospital. But still, for screening purposes, you can definitely have a look at it. And this is really the last slide about this topic. If you go to the next slide, Tommy, I wanted to show that on my LinkedIn page, you can follow me. And then every week I summarize certain articles. And this is an article I wrote a few weeks ago. It's about screening with fractures with ultrasound. And in this case, it's about what's the added value of screening bone with ultrasound in addition to the Ottawa anchor rules. So it's an interesting piece. So I can definitely recommend reading it. Yeah, so I hope that that's an answer to Roberto's question.
Yeah, well, of course, I already learned a lot. And sometimes it's not, of course, so easy to follow along and to find the structures, but I think I managed quite well, which shows that maybe I do have at least some skills to learn an ultrasound of MSK. So, yeah, fascinating, of course. You know, you were talking about fractures. And of course, screening. I actually heard that some large soccer teams always have an ultrasound scanner during games to screen for injuries. Have you heard about that? Is that something that is true?
Yeah, so SonoSkills has actually trained quite some medical team members of professional football clubs. But not only football, also other teams like in handball, hockey, swimming, and also some Olympic medical professionals. And yes, they're using ultrasound actually to screen for pathologies. Sometimes it's useful to have an immediate check whether a person can play, yes or no. And ultrasound is good at that.
Yeah, fantastic. Good. So let's come to the next question that actually is a bridge to athletes. And the question that Tristan wanted to ask is, how can MSK ultrasound be used in rehab for athletes?
Yeah. So if we go so I knew that this question of Tristan was coming up, so I prepared it. So thank you, Tristan, for your question. So if we go to the next slide, then yeah, it's a boring slide. I always like to communicate in images, but sometimes you cannot avoid text. This slide shows you a little bit the flow, which is the whole process of working with a patient, or for example with somebody who is a professional sporter. So you can see that you have the clinical examination, the diagnosis, the treatment plan, the treatment, the evaluation, and in the end, to see whether we should continue with the therapy or we should stop therapy. And the case I want to make actually is that you can use diagnostic, or you can use ultrasound in every step. And it's not only a diagnostic tool, but it also helps you in the other steps of taking care of a patient. Of course, we understand that in the diagnostic part, you can see, for example, muscle tears, and you can see tendon tears, inflammation, injuries, bursas. You can see, a lot of things, right? So we all understand the diagnostic purpose of ultrasound. But let me show you some examples of therapy, for example, how to use ultrasound in a therapeutic session, and also to target your athlete, professional athlete population. So this is a slide which shows actually that a lot of people do dry needling or needling at all, injections nowadays. And in this case, you can see a elbow being needled. On the right side of the image, you can see a muscle. Within the muscle, you can see a bright white line. This is the needle. And very close to the needle, there is also a big nerve, the median nerve. And of course, when looking at the nerve, you want to avoid it. And this is good because ultrasound guided, you can steer the needle much better, and this allows safer treatment of patients. So if we go to the next slide, this is my colleague. His name is Marc Schmitz. He's from Sweden, and he actually is a physiotherapist, but in Sweden they have a little bit of a different model that physios can also do injections and ultrasound. And so he's doing ultrasound guided injections with the athletes or the patients he's seeing actually. And it is a proven fact actually that with doing injections ultrasound guided, that you can it's safer. You target much better the tissue you want to target actually, and with that you can also see a little bit better result in contrast to, for example, blind injections. Yeah, so elastography, I think it's a promising tool because it's a thing which you can use it's a thing you can use not only when a patient has problems to see how a tendon has changed and where there is a tendinopathy, or where there is a tear, but you can already see changes with elastography prior to that you can really see changes with black and white ultrasound. So in a much earlier phase, you can already see changes. Sometimes even if people don't have that much problems, you can already see starting changes, the degeneration of the tendon, and in an early phase, because of this input, you are aware of this, and then you can address this with, for example, targeted exercises. So if we go to the next slide, it's showing something that is called power Doppler. So power Doppler shows you actually the vascularization, the neovascularization of the tissue. And these bright orange colors, which you can see in screen, usually you would not see this in a tendon. So in a healthy tendon, you don't see this. The more neovascularization you see, the more painful and also inflammatory processes are going on with the patient. So sometimes I get professional athletes and people, for example, the team physio wants to know, can I put them back on the field, return to play, is it safe? And we scan the tendons and we still see the loss of neovascularization. Well, this is a sign about a certain, how to say it, how painful it is still for the patient, and also how loadable the tissue is, and how the inflammation actually is at the moment. So also this gives you a tool in in not only a patient population but also in athletes. Muscle tearing, you can also see, because in a lot of radiology departments, they are really focused on joints and not so much actually at muscle tears. So I think that even nowadays, there's still a lot of work to be done in research also about muscle tears. And I think that that people with a fascination for muscles can beautifully image actually these problems and these tears. If we go to the next slide, this is also something new. And I have to admit that I don't know that much about it. This is something really new. One of our trainers, he actually teaches courses in this, and this is called muscle sound. And with muscle sound, you can they use it not only in a very in a setting of emergency care, but also in top sports. For example, I know that in the NBA and the NFL, they use this to screen their athletes. And what they do is actually also they place a filter over the ultrasound image, and with this you can see fatty infiltration. You can see also you can see fatty infiltration, but also glycogen storage and depletion. You can measure pronation angles, and this tells you actually how fit a certain muscle is and how loadable it is. So this is an excellent tool also for return to play. So yeah, have a look at that muscle sound. This is definitely something which will be bigger in the future. And in the next slide, I can also show you, Tommy was asking, how do, and you know that football teams, they use ultrasound. Yeah, and this is a product, it's called a probe fix. And this probe fix is strapped in this image to my leg. And what you see actually is that while cycling, we have a real-time input of the ultrasound image. So this is a really functional assessment of me cycling and having this real-time input of the contracting muscles. And of course, you cannot only do this on a you can do it on a bike, but you can also do it on a for people who run or who do some walking. So in various settings, you can do that. And the last example I want to show you is actually this one. For example, shockwave. Also, people use this in a therapy sessions, and with ultrasound guidance, much better, where you can find the calcification and then do the shockwave. So I wanted to highlight to, I believe Tristan it was, that you can use ultrasound in many therapeutic sessions and then to guide your therapy.
I mean, it's incredible actually the breadth of ultrasound and what you can do with it. And just looking at your images and the applications, I can see there's going to be a lot of more developments coming in sports medicine, but also, as you mentioned, in diagnosing maybe muscular problems. So this is incredible what is coming towards us. Also considering that the image quality will get better and better as we go along. Fascinating. We got a question from YH. I don't know exactly his full name, but he wants to know how to find the pudendal nerve by ultrasound.
Yeah, that's a good question. And actually, this is also not so my expertise. So in the pudendal nerve, of course, we can find in the pelvic area region. And my team we have 25 trainers at the moment. They all have their own expertise. And one of them, her name is Monse. She's from France. And she is the trainer for pelvic floor problems. This is being taught in the pelvic floor courses. So also that to scan the pudendal nerve, this is not on a bachelor class level. In the bachelor class, we have created in collaboration with 123 Sonography, is focused on the scanning of the upper and lower extremity joints. So mainly focus on muscle, tendons, also a little bit nerves, but not so much in the pelvic area region.
Yeah, I mean, I would assume it's a huge area, considering the different parts of the body that can be scanned with ultrasound. And the strategy we have here is in teaching. We want to, of course, start with a basic course and then work ourselves towards hopefully every region of the body to give everyone a chance to learn what they're interested in. And this is certainly something that we'll be doing in the future. Let's come back again to Tristan. I think this is his second question, and he wanted to know what are the different methods used in biofeedback and in what circumstances should it be used? Marc.
Yeah, so in ultrasound is a very good tool to visualize certain muscle groups, and we know that, for example, in the abdominal area and the lateral abdominal muscles. So, for example, a transverse abdominis muscle, that people have troubles with contracting the muscle, and that because of this, people are at risk for low back pain or pelvic problems. This is an example because you can also do biofeedback on the diaphragm. For example, in people who have lung problems, in singers, in speech therapy, to address a proper diaphragm function, and then to optimize breathing, to optimize speaking, optimize singing. You can also do biofeedback, for example, on the pelvic floor, the course I was just mentioning, to how to contract certain muscles in the pelvic floor and to prevent, for example, incontinency. But in this slide, you can see somebody with low back pain, and the transverse abdominal muscle is being trained. And this should be done then, of course, in various positions. In the beginning, first is showing the person in a supine position where the muscle is. And then in this supine position, you are going to train the contraction. And once the person gets more control over the contraction, you are going to challenge the person in a little bit more difficult positions. For example, first on after supine, you can do, for example, working with the legs, contract the muscle and lift up your leg, lower the leg and release the muscle again. Or, for example, in a Superman position, that is on hands or knees. Or in sitting position, and in the end also in standing position. And if you are in standing position, then you can go to, for example, to a squatting position. So what I want to say is you can address tasks, and in each task the muscle should be contracted in a correct position or in the correct way, and each time with this feedback to the patient. So this question Tristan asks is actually like a 2-day course. So now in a minute, I wanted to highlight a little bit about how to use ultrasound in this, but there is of course much more to tell about this topic. A few weeks ago, I also posted a LinkedIn post about this topic. That is the next slide. And in this slide, you can see also what I did is I scanned 2 people in various positions, and in a relaxed and in a activated way. And there was a little bit of a discussion and a talk, what I did about how to calculate it and how to work with that in a certain activation ratio. I also can also recommend reading that. So I hope that this is a question for, or an answer to the question of Tristan.
Yeah, I guess it again shows there's more and more doors opening to demonstrate the importance of MSK. And maybe as a feedback, we now have far above 100 spectators now with us. We're coming close to 150, so there's people who are still jumping on the bandwagon. Thanks for all of you who are here. We're very, very gracious that we have the opportunity to teach all of you. Maybe we'll have time for a question, and then I want to show something or explain a little bit about the project of SonoSkills and 123 sonography. But before I do so, one more question. How should I scan a patellar tendon? This question came from Günther. Marc, do you want to say something here, or should I play the video?
No. So yeah, Günther asked this question, and so I prepared the question. And what we did actually is that we placed on the 123 sonography platform 17 hours of content, 22 chapters with in total, I think, like 150 videos. And what we did in the MSK bachelor class is we paid attention to not only anatomy and sonoanatomy, but also to how to scan certain structures, and also if we scan it, how does it look like in pathology. So these are roughly the chapters we offer, and this we created for the shoulder, the elbow, the wrist, the hip, the knee, and the ankle. And Gunther's question is actually about scanning the patella tendon. And so I prepared a clip for that, and this is also a clip which is part of the MSK bachelor class, which is on 1 to 3 sonography.
The fourth transducer position of the knee protocol is scanning the infrapatellar region, and we're going to do this longitudinally. And the patient is in supine, balls are underneath the knee, so that we have this 30-degree of flexion to tighten and stretchen the patella tendon. But later we're also going to make a flexion to 45 to 90 degrees. But first in this 30 degrees. We're going to place the transducer on the patella. So what we see is the patella bone, hyperechoic with behind, we can see the acoustic shade. And these are the first fibers of the patella tendon, the patella ligament, going all the way horizontal to the tibia and inserting at the tibial tuberosity. So this is the insertion at the tibial tuberosity. You can see that the patellar tendon has beautiful fibers horizontally in screen. They are perpendicular being scanned, so there is no anisotropy. Underneath the
so that was a little bit of a highlight how to scan the patella tendon.
Yeah, I think that it's just amazing again to see how fascinating these images are, and I know that Marc did a very, very great job in putting these into videos, and I think when you see these videos, it's much easier to understand than looking at images from a textbook. So this course is definitely something that of course, if you want to learn ultrasound, would be a great way of taking. And we do actually have an offer now where we try to bring people to ultrasound. And I just want to talk a little bit about what our role here is. We as 1 to 2 Sonography started this company in 2009, 2010. Actually, we had the first product out, which was echocardiography, was the master class. And at that time, the reason I actually did it was very simple. I did a lot of courses, a lot of trainings, and I realized I always say the same thing, from one course to the other. Why don't I simply tape it and bring it to the internet? And that's what we did. And we realized that this is actually a very, very good way of teaching, because it gives people the opportunity to look at lectures several times, not only once. If they go to a live course, they can sometimes even fast forward us. In other words, if we are boring, or if think we are not too shallow for what they know, they can just fast forward us, or they can just repeat things once again and over. That kind of is a better way to learn than actually if you're a live course. And we of course then produced more courses in echocardiography, and as you see, we're now spreading to other areas, vascular ultrasound, we've got pediatrics, we've got courses on point of care ultrasound, and now also the MSK. And what we do, especially around the turn of the year, is we try to bring people to engage in ultrasound, because this is usually the time of year where you make something like a New Year's resolution, where you decide you want to stop smoking, or lose weight, or do more sports. And we think that maybe it would be an interesting thing or a good thing for you to actually embark on this journey to learn ultrasound. And that's why we have this offer. And I'll just show you this promotional video clip, which we called Standout, from this offer. So of course, we'll be very happy if you sign up for one of these courses. And there you'll meet Marc again, and if you take other courses, some of our other excellent teachers. So that's just an offer that I want to give to you, and at the same time, of course, we want to be your mentors, and we definitely want to answer all your questions. So that's why we'll come back now to this Q&A session, and the next question that we have for you is, how does a patellar tendon look like in pathology? And this again is a question by Günther. So Marc, can you tell us how a diseased patella looks?
This is a question which is, also I can talk a lot about this. This is also something we discuss a lot in the MSK bachelor class, because it's really important that you know how to read pathology. So ultrasound, doing it, performing it is really amazing. I can honestly say that it really changed my life, because it's very fascinating to really see inside a human's body and see what's happening actually there, and also to see how certain tests how they really work, and sometimes how they don't work. We have sometimes conceptions about and thinking constructs about how something is and should work, and this is what we learned in, for example, in university, and then suddenly with ultrasound you can see that it is sometimes a little bit different. And if you start doing ultrasound, then pathology recognition is key. This is really important in learning properly. So a lot of attention is also being placed in the MSK bachelor class on how to read pathology. So let's have a look at the slide. In this slide, you see the left image is a healthy tendon, and on the right side you can see a tendon that is affected actually. And this tendon on the right side, this is a patella tendon, and it's called a jumper's knee. So we can see that the proximal part of the tendon has thickened in contrast to the other side. It's much thicker. And how does it work? So a tendon gets, there is a certain degeneration going on, a certain irritation going on, and there is a swelling. And this swelling makes the tendon thicker, but also softer, and thus changes also the color from hyperechoic to hypoechoic, from light to dark. This is what we said in the beginning of this webinar. The softer a tissue gets, the darker it gets. The harder a tissue gets, the lighter or the whiter it gets actually. So in this case, we can see that this tendinopathy, this jumper's knee, is that the tendon is actually thick and softened.
Marc, can I just ask a very short question? Do you have normal values for tendons? Would you say, okay, this should be a certain in a certain range, and then you can say if it's above, it's diseased?
Yeah. So what we actually did is, if you look online, you can find protocols, but these protocols we used prior in the courses, but I wasn't really happy with that, because they didn't give that much information, for example, about standard values. And I think that's really important. So what we actually did is we created a new protocol book. And this protocol book has like 180 pages. And so if I go, for example, to the knee, then what we've done actually is that we explain not only how something should be scanned, but also on this page in the lower, you can see all the norm values. So we did a check in the literature, and we made sure that we filtered out all norm values that are available and put them in the protocol book. And so the norm value of the patella tendon is roughly 3.5 millimeters, plus minus 0.8 in standard deviation. And I don't think you should see these values as too black and white. You should see them in a bigger perspective, but it gives you indeed a very good indication how to to assess the tendon. And this book is actually also the book that the people received when the MSK bachelor class launched on 123 sonography. The first 100 people got also this book for free. There was a 123 sonography offer.
Yeah, fantastic. I think it's just so important that you have these reference values, and with a technology which is relatively, I would say, new, it usually takes some time until there's a collective wisdom which is put into some form of a document. And I think, as far as I know, you were the first one who's really put everything together in one kind of a book that people can, use this information for their diagnostics. So fantastic work. So sorry I interrupted you. We can go to the next slide now.
Go ahead. So let us have a look at the next slide. So this is the distal aspect of the patellar tendon, and it might be difficult to see if you're not so experienced in this matter. But what we see actually is that the bone in the left image is really roughened, normally the bone would be much smoother. And what this is actually is Osgood-Schlatter disease. It's a typical disease where the tendon and the bone of the tibial tuberosity have certain changes in mostly boys around 12, 13, 14, 15, 16 years old. And on the right image, you can also see that the tendon shows neovascularization, meaning that there is ingrowth of little blood vessels and nerves, and that it is, in this case, inflammatory process and painful to the patient. So, and then last slide, this shows you a tendinopathy over the whole tendon, the upper image. So you can see that the tendon has thickened over the whole stretch and is also darker over the whole stretch. And in the lower image, you can see that especially the distal part actually is thickened, and that the proximal part is still relatively thin and also good in echogenicity, that it is proximal more white and distally more dark. So you can see that it's more of a distal tendinopathy. So but there are many manifestations of problems. So in this case, for example, there is not only a tendinopathy of the patellar tendon, but also we can see right underneath the patellar tendon, we can see a huge bursitis, infrapatellar bursitis. And I have to say that this is also really fantastic in ultrasound, that before I did ultrasound, I always had my clinical examination, and then I did a test, and then the patient said, "Ooh, that's painful," or I felt a weakness, a loss of strength, but then I still didn't knew what exactly was going on. I know that I could tell that the region, and of course maybe also a particular tissue, but for example in this patellar tendon, I couldn't say, is there a tear? Is there a tendinopathy? Is there a bursa problem? If there is a tear, is it a partial tear or a full thickness tear or a calcification? So I think that doing your ultrasound assessment is important to have more details of your clinical examination. And a clinical examination shows you the relevancy, clinical relevancy, but the ultrasound assessment shows you actually the details of the anatomical tissues.
Now, Marc, a question. I'm aware that a lot of these patients now go through MRI. What do you see is the role of ultrasound in this whole arena of MRI? Is it replacing MRI, or where would you see this?
Yeah, that's a good question. That's a good question. And this is a question which has a clinical aspect to it, a financial aspect to it, and maybe also a political aspect to it. So from a clinical point of view, MRI is definitely a very good tool to screen patients. But to be honest, it's not always necessary, because ultrasound can do many things in a way that MRI also does with certain people at the moment. So in many cases, ultrasound could replace MRI. And I think for the patient, this is good because ultrasound assessment is much more patient friendly. It's quicker, it's easier, it's not so claustrophobic, it doesn't make that much noise, and it's also much cheaper. And this is also very good for society. For example, I live in the Netherlands, where we have challenges with people getting older and costs of healthcare rising to the roof. And we need to limit healthcare costs to be able to pay this also for future generations. And I think that that ultrasound can definitely play a role in this, because in many cases you don't have to do an MRI. Ultrasound is sufficient. It is important to know what can ultrasound do and what can don't. What how to say it? What isn't capable in doing it, and but within the scope of practice, that what ultrasound can do, yeah, it could definitely replace MRI.
Yeah. I mean, I would probably add to this that it is also a little bit of a game changer in who has competence. Of course, you know, the radiologists make the diagnosis. Now the physicians or the physiotherapists are the ones who can make the diagnosis, and not only, you know, giving them more competence, but also making the diagnosis at an earlier stage. So, you know, I see this especially in the area of point of care ultrasound, where now we can, you know, easily make the diagnosis of pulmonary embolism without having even to go to a CT. You know, you might want to do it, but you can already have the high suspicion and be much more selective as to who should get these advanced imaging techniques. So, yeah, a game changer in every direction, definitely.
Yeah, so true, because I think later in the webinar we also speak a little bit about the system development, but systems are advancing so rapidly and being better in quality and becoming cheaper and also becoming smaller. So I guess that ultrasound is becoming more widely available for all kinds of professions. And some people, they would even say it's like a stethoscope of a doctor. It's like a ultrasound system nowadays for a orthopedic surgeon or a physio. Yeah, so I fully agree with Tommy. Yeah.
Yeah, I think the only problem we have to solve now is how do we bring people to this competence that they're able to image, because, you know, with radiology, it goes through a scanner. The issue of imaging is maybe not so difficult as it is with ultrasound. And of course, we also need to train a completely new profession, the skills of imaging, and that is, of course, is a challenge. And this actually brings me to the next question from Keshav Pandey, and he wants to know, how can I learn more about MSK ultrasound? Please help me with the best learning path. What would you suggest, maybe based on what your experience is in your own career?
Yeah, so if you look at the learning, so ultrasound is amazing, but there is also a drawback, and the drawback is that it has a certain learning curve. So optimizing the learning curve is crucial. It is not something that you can learn by only looking at YouTube videos or reading articles. It is definitely something that needs proper attention. And in 2013, an article was published, and that is the next slide. And this article of Mr. Arendt, from Brazil, I guess he is. He wrote an article about the top 10 pitfalls when doing MSK ultrasound. And the 10th pitfall was actually if you invest in equipment, but not so much in education. So that's a pitfall. So if you invest in equipment and not in education, this is not good. You can buy the best system there is, but if you are not being educated properly, then this is not so good. So instead, this author also says it is crucial to invest in your education. And if we go to the next slide, so I'm really happy with the partnership with 123 Sonography, because I think we have a mission, and the mission is that 123 offers e-learning, SonoSkills offers hands-on workshops, and together we offer actually the blended learning concept. And numerous research has shown that blended learning is the best way in learning ultrasound. E-learning is very good because if you have long access, and by the way, long access, then you think about the New Year's deal, the lifetime access. If you have long access, you can review the videos over and over again because they are highly dense with information. And it is important. Remember sitting in a classroom, listening to frontal teaching, blah, 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 and you are being overloaded with a tsunami of information. And if you have e-learning, you can review the videos in your own pace. You can click pause, you can go to the toilet, you can review them tomorrow, you can review them in a few months' time. And also you have the best trainers at your doorstep. So e-learning is really good to prepare for a course. You go at, if you have seen everything, then you go to the workshop and you are fully prepared. And in the workshop, you can do hands-on scanning. And this hands-on scanning is crucial because you don't learn ultrasound without hands-on scanning. You need to hold on to this transducer and really feel the little movements and the micro coordination that is needed to work with the transducer. So my advice is blended learning, and start with e-learning, and then if you like it, then proceed with a hands-on workshop. Before I go to the next slide, Tommy, do you have something to add to that?
Yeah, just a very short point, just to emphasize what you're saying. I think we should all be aware that the time with a teacher in a one-to-one, face-to-face situation is the most valuable time. And it does not make sense, to even ask the teacher questions which you could answer yourself very easily in a goodly structured way in the sense of blended learning, because that's actually a time where you should refine what is not being taught in textbooks, where you can embark on his experience and skills. And I think that's the whole concept of blended learning. When you have this information, you already have this bulk of knowledge, then you have smarter questions to ask, and you can use the time with your tutor much more effectively. And you'll also excel much more in your hands-on skills. So this is also some of the philosophies that we have at 123 Sonography. We think it's just very, very important to prepare you for your patients, for the imaging. And that's also why we're so happy to have SonoSkills with us, where we have an outreach to let people do the hands-on training as well. I cannot, just emphasize this enough. It's just this shortening of the learning curve. That's what we're doing here.
Yeah. And even if you do your hands-on session, so if we go to the next slide, then we at SonoSkills, we offer at different levels workshops. And level 1, the bachelor class, is mainly focusing on the basics, the foundation, the foundational knowledge and skills of the extremity joints and anatomy and pathology. But even then, ultrasound is also something where the embracing of lifelong learning is important. So on level 2, in the masterclass level, you go more into detail, and there is more about pathology, and there is more about clinical reasoning. So on masterclass level, it makes actually the circle more round. So now we launch on the 123 platform, the MSK Bachelor class. And this year, or actually in a couple of days, in 2019, we are going to also upload new courses to the 123 Sonography platform. For example, a ultrasound guided injection masterclass is scheduled. A masterclass shoulder is scheduled. And we have many more topics that we want to upload on the platform, and this gives you even more information about scanning theory and also skills. And then if you're ready with the masterclass, so you continue also on the advanced level, and you can also continue to the expert level, where we have the world's best teachers teaching these courses. We also try to help you with the protocol book we have. I already explained to you a little bit about that. I think it's a good way in having something in yet to hold on to. Everything that is in the book is also on video on the MSK bachelor class. But this is also good to have right next to your ultrasound machine, so that you can have a look at it if you want to scan a patient. And the next slide, also what we try to add is that we acquired a website, ultrasoundcases.info. It's a free website. It has like 7,000 ultrasound cases, so it's free accessible. At the moment, it's a dinosaur of a website. It's like, I don't know, it's created in 2004, but it's highly visited. I believe like 60,000 unique visitors every month. And as from May 2019, there will be a new ultrasound cases website, which we will also use in our teaching, which is also for you. You can upload your images and you get also feedback on that, and this also helps in your learning curve. You can study pathology images, but also you can have feedback on your own images. And the last thing I want to mention is also in this slide is the SonoSkills mentor network. After you have done the course and maybe the e-learning prior to that, and then the course, then it's also good to have sometimes live feedback. So we created a mentor network where people can do internships and with people who are really skilled in doing ultrasound assessments. So it's important to embrace lifelong learning and to have blended learning, to make a lot of images, to have feedback on your own images, and of course to keep track on the recent literature.
Yeah, I mean, fantastic what you guys have put up, and you know, we just basically believe that there's a very good combination between modern technology, the internet, and everything that we can offer there with hands-on training and still being very close to you. So definitely this is the mission that we both have, is we want to be your mentors, and we want to be there for you to help you learn this technique, because it's just such a fascinating technique. And it's the fastest growing imaging technique in medicine, ultrasound. So a very important thing to remember. Now let's move on to another question from YH, and he wants to know, or she, how to differentiate a rotator interval tear from a supraspinatus tendon tear. I even have problems pronouncing all these things. So what is your take on this here?
Yeah, so if you look at the anatomy, it's important to understand first where the rotator valve is actually. So the rotator interval is the area between the pink supraspinatus, SSP, it's on the top of the shoulder, and between the pink or red subscapularis there. Yes, so this zone in between, it's gray, blue, and green. This is the rotator interval, and the rotator interval contains a few anatomical structures, which is the long head of the biceps tendon. And this long head of the biceps tendon is wrapped around it is wrapped the coracohumeral ligament in green. So the biceps is yellow, and the green ligament around is stabilizing the biceps. And we can also see the SGHL, the superior glenohumeral ligament, and these structures are located in the rotator interval. So the rotator interval is really something different than the supraspinatus tendon. So these are two different anatomical regions. So if we go to the next slide, you can see the same rotator interval in cross section, in transverse or in the short axis view. So we can see the supraspinatus, the SSP on the left. We can see the subscapularis or the SSC on the right. And so these are the two tendons of the rotator cuff. And in between, we can see the LBT, the long head of the biceps tendon. And this one is again stabilized with the blue ligament, the dark blue ligament around it, and also with the light blue ligament, the SGHL, the superior glenohumeral ligament, right next to it. So how does that look in ultrasound? So is this slide indeed. So here we can see the several structures. And although maybe this image is not the best image to show, in ultrasound, you really see the difference between supraspinatus on one side and the rotator interval on the other side. So the boundaries in this region are actually quite well defined, meaning that if you see a pathology in the supraspinatus, it's easy to how do you say it, to differentiate from a pathology in the rotator interval. If we go to the next slide, then in this image, and I can show you a little bit more about the anatomy. So first, the left image, we can see first the infraspinatus tendon, dark gray. And then in the middle is the supraspinatus in the light gray. And you can see that the infra and the supraspinatus, that they cross a little bit of fibers. So they have a crossing and they share fibers. This is the weakest spot in the supraspinatus, actually. And a lot of tears and full thickness tears or large tears occur in this region. And this place, it can also happen in the other parts of the supraspinatus, but it definitely can, in many cases, it takes place in this transitional zone. And this transitional zone is 1.5 centimeters, approximately, located more lateral from the rotator interval. So in most cases, you will see the rotator interval and a little bit more to the other side, 1.5 centimeters away from it. This is the weakest spot where you can see a lot of supraspinatus tears. Yeah, so I think that was an answer to the question of Mr. or Mrs. YH.
Okay, I think that answers it quite nicely. I think that we're getting a lot of questions in. We probably won't have time to answer all of them, but what I can promise is that we will collect these questions and send you a mail and give you feedback, because we do want to have all of you get your answers to the questions. Let's move on, and there's another question by Aze Oladimei. I hope I pronounced that correctly. And his question is, are there ultrasound machines available for diagnostic purposes in physiotherapy?
Yes, so thank you, Aziz, for your question. Yeah, first of all, it's important to understand that we always need to follow rules and regulations in a country around with the usage of ultrasound. For example, in physiotherapy, it's not always allowed to make a diagnosis. In some countries, it's important that the radiologist makes the official diagnosis, and that the physiotherapist is allowed to see with ultrasound. So they can definitely use ultrasound. Also, for the therapeutic ultrasound guidance reasons I explained in the webinar earlier. But the physio can make a connective tissue evaluation, but sometimes it's not allowed to make a proper or a real diagnosis. So always follow the rules in your own country. For example, I know that in Switzerland, it's a little bit difficult to make a diagnosis as a physio, in Italy as well. But in the UK or in the Netherlands, it's not so much of a problem. But this only is for the physiotherapy profession. But to answer Aziz's question, if we go to the next slide, then this is showing a few systems. And you can see these systems are a little bit laptop-like models, which are being used a lot in physiotherapy. And this is, and it's not the brands. I just puts several brands there. You can buy any brand, but it's more about how it looks like. So it's a smaller system, a little bit like a computer, like a laptop. So these are being used in physiotherapy at the moment, in many cases. If we go to the next slide, then these are the systems that in many cases are being used in medicine, for example, in radiology and rheumatology. You can see that these systems are bigger. They are also, I can tell you, much more expensive. And it's important to understand that in ultrasound, that roughly, you could say that every euro or dollar you spend, you buy also a certain diagnostic accuracy. So if you buy a cheaper machine, then this machine will have limitations. If you buy it compared to systems which are more expensive, compare it with buying a car. If you buy a Audi A1, it's cheaper than an Audi A8. It's much cheaper, but it has also limitations, and of course, it's not as luxurious as the most expensive car. And this is the same with ultrasound systems. So if you have a budget, then you should buy the best machine possible for this budget. But you have to know that this budget also brings you certain capabilities, but also limitations. But that's okay. If you stick within the limitations of the machine, then you do okay. But don't say things or don't make harsh comments about things that you can't see. Do you have a comment on that, Tommy? How do you?
Yeah, I think it's it's a very important topic, and we in cardiology, or at least I get very many questions also. Which system should I buy? How much money should I spend? I think the topic is a very complex one. I don't know if it's the same in MSK, but in cardiology, it's not only a question of the quality, but it's also a question of which features you want to have. And we have millions of different features that are promoted by the industry. I think it's also important to decide what you want to do with the machine. You might not even need these features, and you can actually save a lot of costs if you just leave them out. I mean, if you don't need 3D, if you don't want to have techniques such as speckle tracking, you can still settle for very good quality by just stripping down. And sometimes you can still buy maybe the A8 Audi, but maybe you might not have the sunroof, and you might not have whatever the tanned shields. So this is also something to consider, and it's also important to consider what you want to use the machine for, because ultrasound is ultrasound. The machines, however, differ with respect to which transducers you equip them with, and also where their main focus is. So you will have scanners which are specifically dedicated to one area, such as maybe cardiology or vascular or MSK. And sometimes you can also have a machine which is a very good overall machine where you can have good quality in all areas. So these are also issues to consider. And then, my suggestion always is just get the scanners in and just test them. The vendors are happy to bring them, and spend time with the people who bring the scanner in, the vendors, test them on certain situations, the patient who is good to image and difficult to image, and get your own feeling for it. That's how I would usually use. And me in cardiology, I usually have a few things that I always look at, and if I see they work there, then I know the machine is of good quality.
Yeah, or what I also say to people sometimes is go to the Medica fair in Düsseldorf, or the Dubai Health fair, or the RSNA in Chicago. All the vendors are together there, and you can test the systems. Or, for example, go to the 123 Sonography Live event in Vienna. So you had beautiful systems lined up there, and of all brands, so you can also test them there. So if we go to the next slide, I just wanted to point out that technologies is rapidly advancing, and nowadays you also have these handheld devices, tablets with attached to it a transducer, sometimes wired, sometimes without wire, wireless. And I think this is a very promising development. It's a much cheaper way to enter the field of sonography. But again, The prices are much lower than the systems I showed you a minute ago, and they also have limitations. But these systems, they have great capabilities in scanning the bigger structures and the bigger pathologies. So it's a promising development, and I think that the technology in the next decade is rapidly advancing and making the ultrasound available for everybody.
Yeah, fantastic.
So maybe one thing is that so the diagnostic value of MSK ultrasound is depending for a big part on the system you have, but also for a big part depending on you, the sonographer, who should be trained and properly, and who should have lots of experience, but it's also depending on the patient. So it's important to know that some regions, anatomical regions, are more difficult to scan than other regions. For example, a ventral knee is much easier than a dorsal knee. A ankle joint is much easier than a foot. So this also determines certain diagnostic accuracy. But also the type of the patient is important. For example, if you have a patient with lots of a high BMI, or a patient who's older, then the clarity of the image is getting less. Mm-hmm. On the other side, if you have a patient who is young and who is a little bit athletic, fit, then the image quality is a little bit better. So there are multiple variables who determine actually in a diagnostic process the diagnostic accuracy. Patient factors, equipment factors, but also definitely the sonographer self.
Okay, fantastic. I do want to take the opportunity maybe to ask a question to our viewers. We are now coming close to 200, so there's more and more people coming in actually, which is very good, and we're very happy. But I would be interested to find out how many of the viewers are completely new to MSK and have never used MSK ultrasound. So if you have never used MSK, just simply type the word yes. And if you, well, let's put it this way. If you are familiar with MSK, write yes. If you're not familiar with MSK, write no. So you can do that in your chat box, and then we'll collect the statistics and maybe give the feedback to the community. Just an important thing that I would like to know. We have another question in the meantime, and it's from Dr. Jacobson, and he wants to know she wants to know for trigger points, injections with ultrasound guidance, what images are important to save and document? When coding requirements say real-time images, is that video?
Yeah, so I think I'm not fully sure about the last part of the question, but I think that that the answer to that is yes. So real-time suggests that it's video. Ultrasound is actually a high number of static images in a very short second, and together these images, they create a certain video, and making it actually real time. If we go to the trigger point, which images are important to save, then first I want to show this, for example, in elastography. In black and white, a trigger point looks, in most cases, hyperechoic, so dark, and so a trigger point is dark. This means that it's a little bit difficult because not every dark spot is a trigger point, right? So a trigger point is dark, but not every dark point is a trigger point. So elastography can show you much better where a trigger point is, because in elastography, the trigger point gets really a different color. At least this is what early literature is saying about this. This is still a topic that needs to be investigated much more. But as you can see now in the literature, this is what actually is being stated. So if you needle, then I would use both black and white and elastography if possible. If we skip to the next slide and go straight to the slide after that, yeah, one, and then now the next slide. Yeah, this one. Then in SonoSkills, what we do actually is we have a pathology checklist, and this checklist shows you how to read pathology images and how to recognize the pathology. And if we zoom in on one part of the checklist, if we go to the next slide, then this is being seen. So what we advise actually, and this is maybe also good advice for the capturing of the images, is that we always propose to scan every pathology in 2 planes. So the short axis, long axis, transverse longitudinal, so that if you look back in the patient file, you always see in 2 planes the pathology, so that you can say something about the 3-dimensional aspect, length, height, and width. But we also recommend in scanning both on the affected side and the non-affected side, because sometimes you think that the patient has a pathology, but if you compare it to the healthy non-affected side, then the patient has, for example, the same anatomy there. Showing that it might be an anatomical variant on which you were looking at. So left-right comparison, always measuring in 2 planes, and if possible, also use the measurements, for example, a distance measurement or a cross-sectional area measurement, which makes it better. So this is about static images. What I do with interesting cases, or difficult cases, I always record clips as well. Next to static, I also record clips. And these clips are also being stored so that if I need to discuss in the future with a colleague to review the case, then a clip is much easier to discuss. Because in ultrasound, only a minor movement with the transducer already changes the image a lot. So in that way, if you use real-time clips, then it's a little bit more accurate. I think that was an answer to the question.
Yeah, fantastic. So I actually got the results back, and so we have approximately 65% of the people who are in the webinar now who do not have any experience. This includes, for example, Anka. And we have approximately 35% of our users who do have some experience. So I do see that there's a lot of novices here, but I think that is exactly what we were hoping for. We hope that we can bring this technology of MSK ultrasound to a broader population. So thanks for giving us the feedback. And I think we have another question, this time from Dr. P.S. Balakrishna. Maybe we'll also answer this, and then we will probably need to at some point end this webinar because the new year is approaching. Okay, but let's still answer this question, which is in plane tech better or out of plane tech for ultrasound guided sciatic nerve block?
Yeah, so I think that I don't do myself injections. Also, I have in my team people who do this. And at the moment, we're building a great MSK guided injection course, which will be on the 123 sonography platform somewhat just before the summer, if I'm not mistaken. But if I think about this question, I would say that in plane, meaning that you are in plane of the needle, is better than out of plane, because with in plane it's much better to guide the injection needle, ultrasound guided. So I would, but in this I'm not 100% sure, but I would say that in plane is better because you have a much better visualization of the needle.
Okay.
But if the doctor wants to be sure, I can really recommend the MSK ultrasound guided injection course.
Yeah, I think I'm aware that at least in the vascular access arena, there's all sorts of different transducer technologies where you can actually poke the needle through the transducer, and there's new technologies that help us to perform exactly what I guess is also important for MSK arena, to really hit the right structure with the needle. So I guess this is something probably also dependent on the experience of the operator. Good. I think
the operators. Sorry, no. So the operators we work with, they are highly experienced. I don't do injections myself, so I'm not the golden standard to answer this question. But you need a lot of experience to do proper injection imaging.
Right. I think we will come to an end to this webinar. I first of all want to thank you for being with us and for all the tremendous work you've done in the area of MSK. And I know you have huge plans going forward, and I'm sure that we will see much more of you and your teaching on our platform, and all those who of course visit your hands-on courses and utilize the network that you've put up will certainly be on the forefront of MSK. I also want to thank our users for being with us, for staying with us so long. We planned to do this for an hour, but now it's 1.5 hours. I could go on for another half an hour or two, because I learned so much during this webinar, and I definitely hope that you learned a lot as well. One little last request I have from our users: if you were happy, just simply put the word happy in your chat box. We want to get a little bit of a feedback from you. And for all of you who were maybe late to the webinar and did not see the beginning, we're of course screen recording this, so we have a videotape of this webinar, and we'll be sending it to you so you can view it again and again and again. Like we said during the webinar, that's the beauty of online learning. I want to again thank you all, and also wish you a very, very nice Happy New Year. And I do hope that we will see you in maybe one of our courses, or at a later stage, maybe even in person. So thanks again, and Happy New Year. Thanks to you, Marc, too.